Right, I'm the Irish taxi driver back here with Tony O'Sullivan, doctor, paediatrician at Lewisham A&E, and his wife Olivia, fighting to keep their A&E, and they took the government to court and won. So we was just talking about Jeremy Hunt and the court and everything. Who's it? And then we went on to talk about McKinsey, this woman who's getting £6 million. Who's the new leader of the NHS? This Stevens.
I'm not sure where he's come from, actually.
10 years US private healthcare.
He's American. Is he English?
Yeah.
Oh, well, he worked several years in England, and he's worked several years in America, working for United Health in America, I think. So he's got the background that he knows how much money's in health, and he knows the mechanisms for getting people to start creaming off the profit from it.
Because there's another guy, Malcolm Grant, as well.
Yeah, but the new head was the architect of the Labour reforms. He went from working in a...
Is that Malcolm Grant?
No, this is the new head.
Stevens
worked for Tony, for
Tony
Blair's
Blair.
Government.
That's
and
right,
helped
yeah.
to start the whole thing off.
Because we have to know that, Olivia, don't we? We have to know that the Labour started with the PFIs, and that is a big problem here.
Yeah.
Because down the road we have the Prue, Farnborough, which was built for 118 million, but we're paying back, what, 1.2 billion on a PFI.
Yeah.
This
that's right. The two.
We had this People's Commission. It's a shame you couldn't come to it, in Lewisham at the Catford Theatre there, and we had this PFI expert, and she said that with the PFI, for every hospital built and paid for under PFI, you could build 2 or even 3 without the PFI, if you know what I mean.
Well, the whole PFI thing is just a scam, because they said that the government can borrow money at 4%, but what they want to do is they want these other people to build for 75%.
Yeah.
This is Wonga within the NHS.
It really is a disgrace. Over time, the 2 PFIs in the South London Healthcare Trust, which is now broken up, the total repayments would have been 11 times the original cost, at least 11 times. And there are other PFIs in other parts of the structure, Ministry of Defence buildings, schools and so on. And for some reason, the contracts in the health service are by far the most expensive.
Yeah.
So something like schools will be 4 times, which is a kind of a bit more like a kind
But
of...
it's still not the way to go. I mean, you're borrowing money at a rate that, you eventually got to pay it back, but they just want to divvy up on the books for now.
Yeah.
I
It's
think
all,
they saw
absolutely,
the health service as just like ripe for the picking.
Yeah.
Like so much money in the health service.
But this has been going on since the Magna Carta. This is when they were taking taxes years ago. It's the same thing. What they want is the money we should be paying should be going directly to the firefighters, to the nurses, to doctors.
Yeah.
They want to bypass that and put it over there, so they get less. That's the only way they can make a profit.
Yeah. I mean, it's a sign of the level of civilization that we've got something like the health service, and we've got a fire service, and that's what development of civilization is all about. That it comes out of taxation.
I was speaking to this lady from probation. She was head of probation the other day, and they want to privatise it. Chris Graylin's putting it through.
Absolutely.
She said, "Where is the profit?"
Yeah.
She said, "If a company is going to come and take on this, where is the profit? Where is the growth?" And that is scary, she said, when you start to think about things like that.
Yeah.
And that's the same with the NHS. Where is the profit and where is the growth? Richard Branson, right, he got the palliative care of dying children. He got children's services in Devon.
Yeah.
Think about that.
Yeah.
Yeah.
And the only way to make profit there is to reduce the number of staff and to destroy the quality of service.
And to take the money.
And it's easier to see where you get money elsewhere. If you give people drugs that they don't need or operations that they don't need, and you're being paid for every piece of activity, then people will go to doctors, as in America, and they will be overtreated, and that's where you get the money and the profit from?
The profit is the cut in services and the lower wages. So it's re-employing staff. You know yourself that there's a lot of already now we have bank staff, and bank staff are great. You know, they're coming and, but there's a lot of agency people. They, you know, that cost, the money is going to the agency. You know,
but you know, like Virgin Trains has had a huge, massive public subsidies. It'd be the same for the health service. That public money is like a pot of gold for them, isn't it?
Yeah,
you know,
but all of these people, that's how they've made their money, their whole careers. Richard Branson, it's all about, you know, it's about feeding in to the public purse, because they know that is the largest amount of money anywhere. You know, we collect 1.5 trillion every year.
Yeah.
That's more than every corporation. So that's a bank of money. They want it. You know, and that's what the service, do you know, and they use things like the media. What do you think about the way that nurses and doctors have been treated by the BBC, Sky, Daily Express, Daily Mail?
God, it's been, I mean, conspiracy theory, really. It has been a conspiracy of silence, and a conspiracy of silence about the noise that we've been making, about the dangers of going on. And then there's a kind of orchestrated cacophony against how terrible nurses are and how terrible doctors are, and you can make any organism fail if you cut off its oxygen or if you cut off its money. You can make anybody fail. And in Stafford, you know, I mean, we've been saying recently, you know, you can't mention Stafford without somebody saying, "Ooh, that was terrible." It was terrible. It was. But the management there bought the idea that a foundation trust was the financial way forward. They prioritised money and not people's care. They refused to listen to doctors and nurses warning them what was going on. So hundreds of lives down the road. I don't know how many actually died, because there's an exaggeration in all of this. You don't know where you are in the end. But something really, really bad happened. As soon as that was all exposed, and good for the families that did expose it, then they invested more in nursing staff. Now it's one of the better hospitals in the country. And what are they going to do? They're going to close it because they say they can't afford it.
But that whole thing about like whistleblowing and the thing in the NHS, that the press, they feed on that, you know, and there has been, like, the last 2 or 3 years, so many negative stories.
Yeah, absolutely.
You know, like talking about nurses losing bodies, going on a safari. You know, it's been appalling. They've done it to the teachers. They've done it to the firefighters.
And there are good and bad individual people. There are incompetent and incompetent people in every organisation. Let's think no further than the banks. And, you know, any mistake that's made in the health service becomes proof that the health service is rubbish. Whereas, you know, looking at the banks, my God, what a mess they've made of us now.
Why do you think that there hasn't been like a national strike over the privatisation of NHS?
I think there's a lot of success has been made by successive governments and the use of the media to keep people in ignorance about it. So I think people are ignorant. They're told lies. Deliberately, they're told lies. That, for example, that closing this hospital is going to save 100 lives a year. They're frightened about their jobs. Their living standards have gone down and down and down. So there's a mixture of ignorance and fear, and I think that's one of the most magnificent things about what's happened in Lewisham, because
I mean, they've really led the way, and I mean, that is the way forward, and it is about using the law. But they, you know, that all this cutting of legal aid, cutting of judicial review, you know, that's going to impact.
It's all part of removing slowly, well, quite quickly actually, the right to protest in various ways.
The right to protest has been taken away, and there's also like a lot of filming of people when they go on protests. You know, there's a lot of, you know, they don't mind you on the social network, but as soon as you go out on the streets, there's a big shutdown. And, you know, we saw with not a lot of media coverage for the march up in Manchester. And, but I think, you know, Lewisham has been fantastic, but I saw that some lawyers are closing their doors because of the cuts to legal aid, like Michael Mansfield or someone the other day. That's appalling.
They went out of business.
Yeah.
Well, you know,
Their chambers
yeah.
actually helped us do our People's Commission.
They were doing everybody. They were helping.
They were doing it free.
Exactly.
That 90% of their work was from legal aid, because those are the kind of cases that they were willing to take, and so many people needed them.
This government is like a full-on attack,
Yeah,
as assault
absolutely.
on you know how they want you. They want you on your knees. They want you working on a 0-hour contract, where in your workplace
Pound
with no
stretcher.
exactly. But even if you're not in pound stretcher, even if you're a nurse or a firefighter, they want you working for a private company, no rights, no union.
Absolutely.
You know, no pension, you know, begging just for like, you know, every day there's something different. Look at them, they're sitting in with their energy bills being paid for.
Yeah.
I think what was great about the Lewisham situation, you know, I mean, obviously, when people are under threat, I mean, there's 3,000 people work there. In the health service, you wouldn't necessarily think of strike action as your first option, or even an option further down the line. But what was been fantastic for them was like the extent of the community support. You know, they've had a really terrible year, not knowing whether their jobs are going to be there, but they've hung on in there because the community's been so strong. People talk about going into A&E, and like, it's like people are, you know, saying how grateful they are, and that really gives strength to the A&E staff and all the hospital staff. It wasn't just the A&E under threat, you know, it was maternity and children's and all the acute and admitting services.
Yeah.
But he said, like, he came when he lost the other day. He lost it was on the Tuesday. On the Wednesday, he stood up in Parliament and said there's going to be closures and cuts in North West.
Yeah.
And then on the Thursday, there was a thing from the Office of National Statistics and the BBC saying that things have to be done about the A&E.
Yeah.
On the Irish Taxi Driver, this, my friends, has been Dr. Tony O'Sullivan and his wife, Olivia.
Yeah.